It's been 3 years since Suzanne and I decided to take on the mission of changing cancer care in our community, to take on this horrible disease. The battle is real for us. It's touched our lives. It's personal.
When we started Comfort Project 360, we knew that the journey that patients and their families are going through during this time is a difficult one. Everybody's aware that the doctors are there, they're taking care of the body, but there's a whole other aspect to the care that goes into and the struggle that the patients and their families are going through. That's environment, it's small touches that just make a difference during their visits.
When a patient is diagnosed with cancer, it is a frightening and emotional time for the patient and their family. The great work of Comfort Project 360 provides that added dimension, that human touch, that really assists and helps our patients and their families through this very difficult time.
When I was approached by Dr. Grant to participate in her department at Saint Barnabas, it was a no-brainer. It was, of course we're getting involved, of course we want to make a difference. And it was easy because everybody wants to make somebody else feel just a little bit better. And I know whatever is happening in that department is making people's lives a little bit better. And it's very important to my husband and I to be part of it, to be part of our community, to be part of Saint Barnabas. There's nothing like it. It's an amazing institution. And right here in Livingston, we can make a difference with Comfort Project 360.
In the summer of 2014, my back hurt, my ribs hurt, and it never occurred to me that I, Ella, would have a relapse, a metastases. It never entered my mind. And finally I went to the doctor, and within 24 hours we knew that it had spread to my bones. I started chemo, and I've been on chemo. It will be 2 years in February, and the chemo has stopped my tumors from growing. Chemotherapy is frightening. You just don't know how you're going to feel during it, how you're going to feel after it. And if you're alone, you're alone. It has to be the loneliest place. But the Comfort Project now gives blankets, they give food, and they give you a friendly smile. And that is the most important thing.
I really feel it's important for people to understand that even the things that might seem regular to you when you're not going through it, it's really huge for some people that are going through cancer. To know that through the Comfort Project, you really can offer comfort to somebody who's by themselves and spend a minute or 2 or 3 with someone who just needs a distraction. It's a gift. It's really a gift.
I was diagnosed with breast cancer in the spring of 2008. And I had gone through chemo and I did a double mastectomy. And I thought everything was going great. But then my story changed because in spring of 2014, I had bone pain, and I went back to my doctors and we found out the breast cancer had metastasized to my bones. As I'm a patient there, the volunteers are so warm and so giving, and they make all the difference in the world. In order to live your life, you live the best you can, and cancer's not doing that. Cancer is not taking away one moment of my life. That's it.
Comfort Project 360 has touched over 50,000 people walking through the doors of the Cancer Center. If you've supported us so far, thank you. We've done great work. If you haven't, please help us do more. The mission is important. Making a difference in the cancer journey is real.
It's incredible. Everybody's giving back. People are starting to understand what we set forth from the very beginning. And that makes us just want to keep growing this. And it's with support of our community. It all goes back to support of our community, whether it be volunteering in our programs, wanting to develop a new program, or By donations, by generous donations. That's what keeps the programs going. My mom was the strongest person I ever knew, and probably will ever know. And she always just kept going. So I think that when she looks down, she sees that I'm trying to continue her legacy, but I do it for her, and I do it for everyone going through this journey.